Dr. Ravi Rannan-Eliya, thank you very much for being on Insight.
Yeah.
So I've invited you on primarily because of the polling that's carried out by the Institute of Policy
Yeah.
Health, where you are the executive director. So before we get into the political polling, it's an election year. There's a lot of questions that people have. And just for our audience's sake, we've taken questions from Twitter. So we'll be asking direct questions as they've been noted on Twitter and posting them to Dr. Ravi. But first of all, I want to start by asking you to clarify the role of the Institute of Health Policy and presidential polling or of political polling. What is the link between the two? Because a lot of people seem to be confused as to why an institute that's the name says it's for health policy. Why is it involved in polling?
Sure. I mean, that's a question that is frequently asked on Twitter, and that's where I encounter it. So I think several things are put in background. I mean, first of all, I would say that I'm a public health specialist, and I work on health policy primarily. And for health policy, public opinion in a democracy is fundamentally important. And in fact, I have written about the evolution of Sri Lanka's health system. Sri Lanka has, in fact, one of the world's best performing health systems in terms of the outcomes it achieves and the satisfaction it gives the population with the money that it gets, which is not very much. So it's one of the world's best performers, right? And that was not the case if you go back 100 years. The reason that changed, why we became different to the rest of South Asia, the British Raj, was because the Donald Commission back in the late 1920s made a very critical observation. They said, look, we're going to give self-government to the Ceylonese, I guess, or Sri Lankans, but the rulers are not going to pay attention to issues of social conditions, and social conditions, including infant health, are terrible. Housing conditions are terrible. And so they said we have to ensure the rulers are accountable and under British rule, because it was self-government, and they should be universal. They should be, first of all, suffrage for all men, but most importantly for women, because women also are particularly concerned about these issues. That was their idea. It was a hypothesis. And they were absolutely right. So they socially engineered Sri Lanka's political economy starting in 1931. And so health policy, the health system we have, is different to South Asia. And it reflects that democratic heritage. So that's what I know as a Sri Lankan health policy person. But I think in any democracy, health is ultimately a political issue. And so understanding public opinion is critical to that. So I think that's the broad explanation. And then I would add, I mean, the other reason we do polling is we can. And there are two reasons for the we can. We have two assets in a sense, which enable us to get into this space. The first is I actually have training. So I am the executive director. I direct this particular part of the work, which is the polling part. I'm actually trained formally in public opinion polling at Harvard University. And interestingly, I put that on Twitter last night. The Harvard University is a huge university with many schools. It's a research university. But Harvard, for at least 30 years, they've had a university-wide public opinion program, which does research on opinion polling, but teaches also people to do opinion polling, including presidential polls. And I'm a student. I went through that program as well, or to the courses that they organize. And that program is based in the Harvard School of Public Health. So, in fact, if you read the U.S. mainstream press, Washington Post, New York Times, you will typically see about once every 2 months a headline poll, and you go look in the footnotes, Harvard is involved. It's people from the School of Public Health. So I think, that's what they do in America. That's where I learned my stuff. So I have that technical capacity. The other asset we have, which enables us to do this beyond simply wanting to have this information, is that we have this. Almost coincidentally, back in 2019, literally before COVID, we recruited a large national sample of people for a very large scientific study, and that's approved by the Ministry of Health.
How large was the sample?
There were 7,000 households. And it was a very robust design. It was designed for epidemiological research purposes. And so it's incredibly robust. It's probably more robust in terms of its sampling than even standard health surveys in Sri Lanka. And I won't go into the details of that. And we use kind of the latest thinking about how you should sample from Europe and the US. But the other thing is that in that survey, it wasn't just a cross-sectional survey, literally finished 3 days before the presidential election in 2019. So interesting, it was over 12 months. But the other thing is that people who were recruited in the study gave permission to be resurveyed on an indefinite basis into the future. So our ambition was to track the conditions of this nationally representative sample of households, their health, their aging, there was a big focus of this, their experience with social services, their healthcare use, and their opinions over decades. And that was the kind of ambition we had. So this was a legitimate scientific project, and we happened to have that. And so when COVID came along, we didn't have money. I mean, there's very little research money in Sri Lanka, unfortunately, but we eventually got money from outside to do what many other countries did during COVID right from the beginning, which was to use these existing samples to track the impact of COVID, how it's affecting households. So we started doing that in late 21. We started doing that as a phone interview survey. And we added from the beginning, at the very end, we had some voting intention questions, which is, well, see how they would work out. And so we just run with it. So I should explain that this political polling we're doing is about literally, it's about 8% of, it's about typically 3 minutes worth of questions in an interview, which is typically 30 minutes. So it's about less than 1/10 of that survey are the politically related questions, which include not just voting.
But they're getting a lot of attention. So, and I think we'll go into the latest available polling data that you've released with the Institute for Policy Health. So this is for January 2024. Is that the latest one that we have?
I think we've published estimates for January 24. I should just explain why. I mean, yes, it does get a lot of publicity, and that's probably why I'm sitting here today with you.
Yes.
I mean, the reality is that most of the data we collect is not related to political voting intention, but it's related. I mean, we cover lots of things: food security, mental health, healthcare use, employment change, the income status of households and financial stress, all sorts of things. COVID vaccination, we continue to track that. We track even things like COVID symptoms, which could be COVID. And in fact, we've picked up 2 COVID waves since the Ministry of Health stopped testing. So I mean, they stopped testing more than almost 2 years ago now. So there's basically no data, but we can clearly see there have been 2 subsequent waves, just as in other countries, and that we can pick up from our phone survey. So this is all legitimate research. The problem with most of the research stuff that we do, it will typically take 2 years to be published. To a peer-reviewed publication process, writing a manuscript, and it's only just stuff that's just beginning to come out. We just published a paper on COVID, a kind of retrospective review of the COVID response a month ago in the BMJ, which used some of this data. So, but it takes an incredibly long time. And I think my view is that, look, we have this data on voting intention. It's an election year. It's a democracy still, right? We should be proud of that. And it would be very selfish of us as researchers to sit on this data for 2 years till after the election. It is, I think, our moral obligation, our ethical obligation, and obligation to citizens, since we have this information, to put it out. So we don't go through the normal scientific channels. We do the analysis and we put it out on social media.